Hi, my name is Deepika Patel, and this is my presentation on 8 Nurse Educator Core Competencies. The National League for Nursing has described 8 competencies that our nurse educators should possess. First, facilitate learning. Second, facilitate learner development and socialization. Third, use assessment and evaluation strategies. Fourth, participate in curriculum design and evaluation of program outcome. Function as a change agent and a leader. Pursue continuous quality improvement in the nurse educator role. Engage in scholarship. Function within the educational environment. The National Competency 1. Facilitate learning. The first competency in Boyer's model of scholarship is to facilitate learning. Identifying learners' need, learning style, and diversity is essential to teaching. Recognizing student learning style and confidence level enables the nurse educator to demonstrate individual respect and interest and promote a positive learning environment. Studying nursing education has provided me with the opportunity to explore a variety of teaching, learning theories, and experience in applying them through my practicum experiences. I believe learning is facilitated through positive encouragement and a student-centered learning environment. I intend to develop my skill as a nurse educator by utilizing a variety of evidence-based teaching strategy, learner activities, and evaluation method. Competency 2. Facilitate learner development and socialization. This competency focuses on learning style, providing appropriate resources, and supporting students. Nurse educator can facilitate this competency by providing mentorship, opportunity for self-reflection, and assisting students in setting goals. The nurse educator can set an example for students by modeling professional engagement, commitment to lifelong learning, and advocacy. I assist students in clinical setting with different skills and providing thoughtful, constructive feedback and encouragement to students. Being there and providing support to junior 1 students during clinical, I was able to show them that caring is at core of the nursing profession. Competency 2. Competency 3. Use assessment and evaluation strategies. Nurse educators use a variety of strategies to assess and evaluate student learning in classroom, lab, and clinical settings, as well as in all domains of learning. I was able to assess and evaluate my students during clinicals in various ways. I ask questions, watch my students demonstrate skills, and monitor professional behavior during their hours with me. Doing this allowed me to see how the student processed information and to see how developed their critical thinking skills are. I also give them feedback directly and immediately when something was performed incorrectly. This allowed them to immediately correct their technique and remember it for the future. Competency 4. Participate in curriculum design and evaluation of program outcomes. Curriculum design is an important role of a nurse educator. Revision and evaluation must also be done on a regular basis. I had the opportunity to develop a new course syllabus for professional nursing development too with expert teacher and formulate the objective for the class and make sure that they were in line with program goals and objectives. After completing this project, I felt confident in my ability to meet this competency. I hope to gain more experience in this area as I progress professionally. Competency 4. Competency 5. Function as a change agent and a leader. This competency addresses leadership. Nurse educators are leaders who are able to promote change in their organization. Nurse educator can act as a mentor and a change agent by facilitating evidence-based solution to problems. A nurse is expected to be advocate and a leader for the patient and a student. I was able to suggest to my lead professor for the class I'm teaching that it would be best to review medtech charting with the student and include a learning lab before clinical instead of just reviewing in orientation. My lead professor liked the idea and we are planning on implementing this suggestion in fall semester. Competency 5. Competency 6. Pursue continuous quality improvement in the any role. As a nurse educator, you have to seek quality improvement, which include activities that demonstrate lifelong learning. I am planning on maintaining the professional practice and knowledge base by working in the hospital setting while I'll teach so I can facilitate real-life nursing experience to learner and stay current on evidence-based practice, new technology, and social trend that affecting nursing and patient care. I believe I'm a lifelong learner. That's why I have chosen further formal my education by pursuing my master in nursing. Competency 6. Pursue continuous quality improvement in the any role. As a nurse educator, you have to seek quality. Competency 7. Engage in scholarship. Scholarship is a vital part of a nurse educator role. As a novice nurse educator, I will look for a mentor to assist me in developing my acquisition of scholarship. I may initially feel comfortable only applying existing evidence-based teaching strategy and evaluation method to practice. To best prepare student nurses for a future in nursing, I must be an expert in my own nursing skills. To this end, I will balance time spent teaching in academia with time enhancing my personal skill in both the role of a nurse educator and as a nurse. I will look for seminars, workshops, and practice opportunities that further my personal growth. Competency 8. Function within the educational environment. This competency deals with aligning the nurse educator's personal goals and worldview with that of the new institution he or she functions within. To achieve this competency, I need to increase my knowledge of the strengths and weaknesses, background, and interests of my student in order to effectively motivate them to learn. I'm also planning on continuously review and revise the curriculum, program design, implementation, and evaluation to achieve and maintain quality educational format.